Have you heard of the term Systemic Lupus Erythematosus or lupus? Hello everyone, this is Dr. Sagar Bhattad, Pediatric Rheumatologist, Aster CMI Bangalore. And in this brief video, I shall touch upon a very important condition called lupus. This is an autoimmune disease, a disease where our immune system, which is supposed to protect us, starts attacking and damaging our own tissues. These children come to us with repeated fevers, a rash on the face which we call the butterfly rash, oral ulcers, hair fall, and sometimes swollen joints. Now what is worrisome is that sometimes internal organs like kidneys can get affected. Now how do we diagnose this condition? We perform a simple test called the ANA, the anti-nuclear antibody test, to diagnose this condition. Now let me tell you, this disease often presents in the age group of 20 to 30. That means young adults get affected. But then 20% of these patients have their problems starting in childhood. And children as young as 8 to 10 years of age can develop lupus. And sometimes when the diagnosis is delayed, internal organs get severely affected. And that is why when kids have prolonged fevers, rashes, and one thinks of an autoimmune condition, one must think of SLE, and this could be best treated by a pediatric rheumatologist. Thank you.
Dear friends, I'm Dr. Chethana D. I'm a consultant rheumatologist at Aster CMI Hospital in Hebbal. The month of April has been declared as Rheumatological Disease Awareness Month by Indian Rheumatology Association. This is done in order to raise awareness about the common rheumatological diseases and musculoskeletal diseases amongst the public. So there are multiple autoimmune diseases and rheumatic diseases which can affect people of all age groups and both the genders. Now, amongst a lot of autoimmune diseases, lupus or systemic lupus erythematosus is really considered as the prototype of autoimmune diseases. Lupus affects mainly women. It affects women 9 times more than men, and it can affect people of all age groups, including children and the elderly, but particularly amongst women it affects during puberty, after childbirth, and sometimes around the time of menopause. So clearly there is a hormonal association that causes lupus. The symptoms that people need to be aware of about lupus include simple joint pains which could affect the hands, the wrists, even the knees or the feet. People experience significant early morning stiffness and sometimes some swelling in the joints as well. They could also present with sun-induced rashes, especially on the front of the face, called as the malar area across the nasal bridge. They can also affect skin in other sun-exposed areas. People could experience mouth ulcers, dryness in the eyes or the mouth, significant hair fall, Raynaud's, which means hands becoming cold and changing color from white to blue when exposed to cold weather. There could be multiple other symptoms depending on which organ system lupus would have affected. For example, if the kidneys are involved, then patients could be referred to us with hypertension, that is high blood pressure, or protein leakage in the urine. So early diagnosis will lead to a near normal life for the patients, and their life expectancy also may not be really reduced with early treatment. Now, apart from medications, lupus patients are advised to regularly indulge in physical activity, avoid sun exposure, come for follow-ups regularly, and do regular monitoring of blood tests in order to make sure that the medications are not causing any side effects or toxicity or even infections. So I would suggest that if you have symptoms of lupus or you know of somebody who has symptoms, then please for further discussion or for further advice, contact Rheumatology Department at Aster CMI Hospital. Thank you.